Good afternoon, and thank you for joining us for the National Conference of State Legislatures Public Health Webinar Series. My name is Tara Johnson, and I am a Program Director in NCSL's Health Program. I will be your moderator for today. Our webinar is titled State Strategies to Address Adverse Childhood Experiences. Shortly, you will see a poll pop up on your screen. The question is, what do you see as the greatest impact of the pandemic on the health and well-being of children in your state? There are several answers, and I'm sure you probably want to pick more than one, but if you can please answer that poll question right now, that would be great. While you're answering the question, I will touch on a couple of housekeeping items. Today's webinar is a platform for information exchange and engagement, and over the next 60 minutes, we encourage participation through the chat box. So feel free to type your questions in at any time, and we'll do our best to get to all of them throughout the presentations and during the Q&A. To begin building some comfortability with the chat function and also to learn who is on the line today, I invite you to type in the state from which you are calling now. We will use the chat box for any questions during Q&A after the speakers are finished presenting. I do want to briefly mention the resources. Above the presentation, you will see a couple of tabs. One is labeled Resources, and here you can find and download a PDF version of the PowerPoint presentation, as well as some handouts. Another tab is labeled Speakers, where you can read the full bio of today's presenters. You can access these tabs at any time during the presentation. Today's webinar is being recorded and will be available on NCSL's website within a week. And last, I'd like to thank the Centers for Disease Control and Prevention for their support of this webinar. Looking at the survey response, it appears that family economic insecurity is the #1 greatest impact of the pandemic on the health and well-being of children in your state, which you will hear more about from our presenters today. On the slide is the agenda for the webinar. You will first hear an overview of ACEs to level set us. You'll hear from Dr. Melissa Merrick, who's the President and CEO of Prevent Child Abuse America. Following her presentation, you'll hear from Kate Bradford, NCSL's in-house expert on adverse childhood experiences, and she will provide policy examples and considerations for state legislators. Then we'll have a panel discussion with 2 state legislators who have worked on ACEs in their states. We'll hear from Assemblyman Andrew Hevesy from New York and Representative Sherry Conley from Oklahoma. Then we'll end our time together with Q&A. Without further ado, let's move on to the presentations from our experts. First, we have Dr. Melissa Merrick. Dr. Merrick is, again, the President and CEO of Prevent Child Abuse America, and she has nearly 20 years of clinical research and leadership experience related to the etiology course in prevention of child abuse and neglect. Previously, Dr. Merrick was a senior epidemiologist at the National Center for Injury Prevention and Control at the Centers for Control and Prevention. Dr. Merrick, the floor is now yours.
Thank you, Tara. Hello, everyone. So wonderful to be with you in this virtual space to talk a little bit about state strategies to address ACEs. As mentioned, I spent about 10 years of my career prior to joining Prevent Child Abuse America as a senior epidemiologist and scientist at the CDC, and I served as the lead scientist for the Adverse Childhood Experiences study. So I'm just thrilled to be among the representatives today and for all of your interest in all things ACEs. Certainly parenting is challenging year-round, but parenting during a global pandemic, during a moment of acute racial and civil unrest, the load and the overload on families is top of mind for all of us, including myself as a mom of 2 young kids who are virtually learning at home and trying to navigate this new reality. So it's in that spirit that I just acknowledge the heaviness of this moment, but also the increased urgency of our mission to prevent child abuse and neglect and other ACEs. So the mission of PCA America, in case you don't know, is really to prevent the abuse and neglect of our nation's children. And we really envision a world where all children can grow up happy, healthy, and prepared to succeed in supportive communities. We do this through a national state chapter network, including state chapters in New York and Oklahoma, which we have representatives from those states as leaders on this call and have done such important work moving ACEs legislation and policy and socio-political environment. So thank you for their tremendous leadership. So obviously part of preventing child abuse and neglect, of course, is squarely in acknowledging the robust ACE literature. So almost 20 plus years of research that really have looked at these types of adverse childhood experiences, experiences of abuse, of neglect, and of various forms of household challenges like growing up in a home with mental illness or substance use, growing up with an incarcerated parent, for example. Obviously, you see here that this is not the entire universe of early adversity that we know children in our country, in each of your states and around the globe, frankly, are experiencing. So things like peer victimization, exposure to community violence. These are also experiences that likely function similarly to these ACEs, but still much of our research and literature base in this area has focused on these from the original CDC Kaiser Permanente study, which started in the late 90s among an insured HMO sample in Southern California. And it asked adults to retrospectively report on their experiences of these ACEs when they were growing up before age 18. What we've learned from that study and numerous studies to follow in various populations and samples is that ACEs are common. No matter what the sample, what the population, what sector you assess, we know that at least 60% of participants or respondents report at least having an ACE score of 1. What's not reflected on this slide is that we know that if you have an ACE score of 1, you are somewhere between 80 and 90% more likely to have additional ACEs, because we know that these types of risk factors or adverse childhood experiences tend to co-occur in certain families, in certain communities. Here are data from a cross-sample of 25 states using data from 2015 to 2017. And it found that 1 in 6 people reported experiencing 4 or more ACEs. Why that is so compelling is that as your ACE score increases, so too does your risk for a whole host of negative health and life outcomes. So no matter what your sort of health or outcome of interest is, whether you're in the business of preventing mental health problems, preventing obesity, preventing infectious disease, sexually transmitted diseases, if you have healthier children who experience less adversity, you will go on to have healthier adults. I mean, it's not that simplistic, but that is what the combination and collection of evidence in this area suggests. So that said, the CDC in October of 2019 released this vital signs on ACEs. I had the great fortune of serving as the first author on these analyses. But what we did in this paper is using that same combined sample from 2015 to 2017 of 25 states, we looked at these 14 outcomes in health conditions, health risk behaviors like smoking and heavy drinking, and then various forms of socioeconomic challenges or life opportunities, if you will, graduating from high school, being employed, having health insurance. And across all 14 of these outcomes, we found that we could potentially reduce the prevalence of these outcomes if people did not have ACEs. So it basically is a methodology that statistically takes what the naturally occurring prevalence is in a population of any of these and of ACEs, and it says, okay, now let's make ACEs down to 0 from whatever the score is, and we could prevent 44% of adult major depressive disorder. We could prevent 13% of coronary heart disease, the leading cause of death in this country. This equates to up to 21 million cases of depression, up to 1.9 million cases of heart disease, and up to 2.5 million cases of overweight and obesity that could be prevented if we prevented ACEs. This is an important public health lever. We can achieve multiple public health goals, again, if we don't have ACEs. And why is that? What does the science tell us? This graphic, or some version of this graphic, has been around for a long time, but it used to stop at the layer that says adverse childhood experiences, as if they're inevitable. We just see them, we observe them, we measure them. But truly, no, it comes before. It comes from the local context, the conditions, community conditions, societal conditions, socio-political context, and even historical trauma, right? So we know that ACEs get under our skin. There's a whole host of research and brain science that shows that it changes the way our brains develop, the way our immune systems function, our endocrine systems, even the way our genes express themselves. So we have lots of findings that even document a 19-year difference in life expectancy between those who have high ACEs, measured 6 or more, versus those who have no ACEs. So how is it that we can make our business preventing ACEs from happening in the first place? I draw you to this graphic done by Wendy Ellis and her colleagues that they term the pair of ACEs. So they suggest maybe what we've been measuring for decades in this field are really the leaves of this tree, right? But what are the roots? What are the root causes? What are the adverse community environments, as what she labels them as the second ACE acronym? I call these, what are the conditions that really give rise to the ACEs that we observe? So things like systems of oppression, discrimination, lack of opportunity, poor housing quality and affordability, right? And et cetera, et cetera, et cetera. And what is nice about this graphic, I think, is that, it's a tree. We can relate. We understand how a tree grows. It needs nourished soil. It needs sunlight and water, and it needs all of this stuff to really blossom, right? To really grow and to thrive. So if we are about conditions and we take this public health view, we know that public health is what we as a society do collectively to assure the conditions in which all people can be healthy. So this is not what one single organization does, one professional, one discipline, one sector. It's what all of us together collectively do to assure the conditions in which all people can be healthy and can thrive, which is really why then the role of public health in violence prevention, ACEs prevention, is to really focus on the left side of this graphic in primary prevention, preventing childhood adversity before it occurs, thereby stemming the flow of children and families that touch these other systems like criminal justice, like child welfare, even healthcare, right? We are paying tons of money downstream for problems that we should invest in preventing in the first place. This is not to suggest that we stop early adversity before it occurs, and then once it occurs, we say, oh, it occurred, so there's nothing we can do about it. Of course not. We need primary, secondary, tertiary prevention. We need trauma-informed responses, trauma-informed systems, trauma-informed policies, right? Working together, it's a both and to really represent a comprehensive approach to prevention. There are lots of resources out there that talk about a program or talk about a collection of funds that are needed and resources. But I will say in this field, it's very clear that we cannot program our way out of these problems. Again, we need to meet families and communities before they find themselves in crisis, right? We need to keep families strong and strengthened in communities. We know that children will be safer with their families than from their families when those families are supported in their communities. But still, we do have a lot of strategies that have evidence, and we're continuing to build evidence for strategies, in particular for today, policy level strategies that can really help families stay strong and help children to thrive, thereby mitigating the negative health outcomes and costs, really, that come with early adversity. So I draw your attention to these buckets. This is from the CDC's technical package to prevent ACEs. CDC has a technical package based on the best available evidence-based strategies for preventing child abuse and neglect, preventing sexual violence, youth violence, intimate partner violence, and suicide. And then this one I would see as a more cross-cutting one, again, about preventing ACEs. So I kind of focus you on the three major buckets there. These are the ones that really have the potential to make a more population level impact on preventing childhood adversity and helping us to achieve multiple public health goals. These are things like strengthening economic supports for families. I think in the poll, we understand the increase in economic stability and stressors that families are experiencing right now related to the pandemic. But these types of strategies, like strengthening household financial security, family-friendly work policies, these are things like earned income tax credit, child care subsidies, child support pass-throughs, livable wage. For every $1 increase in livable wage, we see states have reductions in child neglect by 10%. Abusive head trauma reduces by 10% in states with just a $1 increase. Paid leave has building evidence for preventing child abuse and neglect. Again, these are some of these strategies, policy levers that can just help ease the burden and the overload on parents so that they can care for their child and engage in positive parenting strategies year round. Promoting social norms that protect against violence and adversity too. I think the dominant narrative in this country remains that it's a bad mom or a poor parent or a young parent, uneducated parent who maltreats their children, versus the norm that we should be boosting, that we all have a role to play in assuring health and well-being of our children, and that my children will actually do better if all children are doing better. In Arizona now, they have a sort of campaign or a messaging campaign to say, what about if we moved from a culture of surveillance, like mandated reporters, to a culture of support, mandated supporters, right? Even that shift in name, what does that do for really boosting these positive social norms that will help keep families strong? And then ensuring a strong start for children, early childhood home visitation, of course, so important at PCA America. Our evidence-based home visiting program is Healthy Families America. But we know that across at least the major 10 evidence-based home visiting models, we meet monthly, all of the models in a home visiting alliance of sorts. But we know that across all the models, we are all collectively only meeting 3% of the need, 3% of the families that could benefit from evidence-based home visitation. We're only meeting 3%. We need to expand access and supports for home visiting, for high quality and highly affordable childcare. Another big economic issue right now is also the availability and affordability of childcare. So childcare subsidies have an increase in evidence to keep families strong and to keep kids connected. And you can see the other buckets of strategies that also have good evidence, but I would say that these are more individual focused and more focused after ACEs and childhood adversity have occurred. So really, CDC recommends that we would have strategies in all 6 of these buckets to really represent a comprehensive approach to prevention. So I encourage you all to also recognize that PCA America has lots of tools that are open and available for everyone to use. We have a 2020 state public policy agenda on our website. You can see a screenshot here. We also, of course, have a federal public policy agenda that's also available. We also develop toolkits from time to time. This one, a screenshot from our paid family leave public policy toolkit. This will include sample draft legislation to consider or draft recommendations to consider. Again, just compiling the evidence for our vast network across 50 states, across red, blue, purple, yellow, orange, it doesn't matter. Preventing child abuse and neglect and other ACEs is a nonpartisan issue. It's an issue that, again, will help us to reach multiple health and public health and prosperity goals for our country and for states. It can only happen in partnership. And we are so thankful to the partnership of NCSL and to policymakers like you all on the call today. But, you know, increasing our unusual partners like business partners and media partners and faith leaders, et cetera, is so critical to this work. Because, again, we would like to replace those roots. Like, what would it be if we replaced all the isms and all of that income inequality, unaffordability of housing and childcare with things like these: jobs, safety, faith, community, therapy? What would be the kinds of leaves that we'd be able to observe instead of ACEs? ACEs are not destiny. It's not that they just are and we have to deal with them after the fact. It doesn't mean that our legislation and our advocacy can only be around adding the words prevention to really a treatment focus. It's about, what do we think is achievable? Love, trust, health, peace, prosperity, all these good things that I know all of us want for all children in our communities. So I thank you very much for your time and attention, and I will pass it back over to Tara.
Excellent. Wow. Thank you for that very informative presentation, Dr. Merrick. It was very interesting to hear about the evidence-based strategies you shared to prevent ACEs. Right now, we'll put up another poll for the audience. And while you're filling that out, this question is related to which of the following policy areas related to ACEs are you most interested in addressing or learning about during the upcoming legislative session? So there are several answers here that you can choose from. And I'll give you a few minutes to answer this question. I do want to emphasize that NCSL has resources on all of these topics: child care and education, behavioral health services, household supports, and trauma-informed systems. And some of these are in the resources document that you can find under the resources tab. So as we wrap this up, it looks like folks are interested in quite a variety of things, which is great. Child care and education and trauma-informed systems are kind of at the higher end, but it looks like folks are interested in all of them, which is wonderful. And you will hear about all of these, or many of these, from our next presenter, Kate Bradford. Kate Bradford is a research analyst in the health program at NCSL, and she conducts research on various public health and maternal and child health topics, including COVID-19, response efforts, breastfeeding, and adverse childhood experiences. And the floor over to Kate.
Great. Thanks, Tara, and thank you again to Dr. Merrick for that really great overview and setting of the stage for prevention and mitigation policy options. I'm Kate Bradford. I'm a research analyst in NCSL's health program, and one of the things I do is track legislation on ACEs. So before we get to some specific state policymaker perspectives, I'm going to provide policy trends and examples based on our legislative tracking. First, I want to acknowledge some of the policy implications surrounding ACEs. You've already seen very similar policy buckets from Dr. Merrick's slides and strategies provided by the CDC. NCSL also has a resource focused on preventing and mitigating the effects of ACEs, outlining options and examples in each of these categories here to support parental stress reduction, build resilience, and broaden access to and coverage of comprehensive health services. The policy levers that can be used to address ACEs can be quite broad and translate across many different policy areas. Our ACEs webpage is linked at the bottom of this slide, which outlines these policy options, and will direct you to some other NCSL programs tracking this information. And I want to point that out because we track ACEs legislation in our injury prevention database, and for the purposes of our tracking on this topic, because the policy arena here is so broad, we have narrowed ACEs legislation to bills that address four main things, which are childhood trauma, child adversity, toxic stress, or ACEs specifically. Using this frame, we have identified at least 31 states and DC have enacted ACEs legislation over the past couple of years. Some main trends involve the creation of a new task force or work group to address ACEs, using trauma-informed services or building a trauma-informed workforce, and some states are targeting behavioral health supports. So I'll run through some examples in each area here. Several states have enacted legislation establishing a group to evaluate mental health and behavioral challenges or to develop appropriate response guidance. For example, Hawaii created a task force to identify students exhibiting certain behaviors or academic challenges, those who may be in need of additional support using an ACEs assessment. Some states, including Maine and West Virginia, created groups to develop appropriate training and responses to childhood trauma. In Maine, that involves a screening and referral process in schools, student-to-staff ratio requirements, and school action plans to address needs associated with childhood trauma. In West Virginia, their work group involves guidance around ACE screening protocols in healthcare settings and certain procedures medical providers should follow after an ACE screening. Other states have enacted laws addressing trauma-informed care or providing training to certain professions that interact with children. Some related to child welfare systems. For instance, in California, they enacted a law requiring foster care facilities to utilize trauma-informed practices, but a lot of action here has to do with creating trauma-informed child care and educational settings. Bills in Indiana and Washington provide for training in trauma-informed classroom instruction and aim to provide safe and supportive school environments. Part of that typically involves reducing or avoiding things like suspensions and expulsions, which remove children from that environment and can create or exacerbate stress and behavioral and learning problems. The examples here in Washington and Tennessee both specifically address this. In Washington, their strategy aims to reduce expulsions by 50% in 5 years, and in Tennessee provides an emphasis on minimizing disruptions to students' education to focus more on positive behavior interventions through a trauma-informed discipline policy. The Education Commission of the states has a report on the status of school discipline and state policy, which is linked here, and they also have a resource on education policy approaches to trauma-informed practices. Many states are targeting behavioral health supports to support children and families' well-being and help mitigate negative effects of ACEs. Earlier this year, Colorado enacted a bill creating the Early Childhood Mental Health Consultation Program to support mental health care across the state. And specifically, the program must be designed to increase the number of qualified and appropriately trained mental health consultants in a variety of settings. A Massachusetts law established the Community Behavioral Health Promotion and Prevention Commission, which aims to promote positive mental, emotional, and behavioral health, early intervention, and strategies to prevent substance use disorder. Each year, the commission submits a report to the legislature with recommendations in each of these areas, including actions that also reduce healthcare and other public costs. And their 2018 report is linked here. In September, Michigan appropriated $1.5 million to develop and operate a Resiliency Center for families and children to address the needs of those experiencing trauma, toxic stress, and addiction. community health centers are often addressed in state legislation on ACEs. And as you may have noticed from the other examples here, schools are well positioned to help detect and intervene early. So many laws emphasize intervention here. For example, legislation enacted in Utah a few years ago authorized the State Board of Education to award grants to provide additional funding for school counselors and targeted school-based mental health supports. When it comes to the pandemic, we haven't really seen many bills that explicitly address ACEs in response to COVID-19. There are a few like these bills in Pennsylvania and Massachusetts that provide additional funding for increased needs during this time. And a number of states have taken other actions to support children and families through state agency direction or various other means. Our COVID-19 resources page is linked here, and I've included links to a couple of our Children and Families Program resources relating to ACEs and COVID-19. You can check out our injury prevention database to search through additional ACEs and child maltreatment legislation. And here are some other NCSL resources for you to take a look at. Our Children and Families Program covers a lot of policy areas related to ACEs, including home visiting, early child care and education, paid family leave, et cetera. So if you have any questions on any of those areas, we are happy to connect you. Here's my contact information. Please don't hesitate to reach out with any follow-up. I'm happy to answer any questions. And with that, I will hand it back over to Tara.
Excellent. Thank you, Kate. Thank you for that very informative presentation. I know for our members, it's really helpful to see other examples from a variety of states. So thank you again. And next, we'll hear from two of your peers. We'll hear from Assemblyman Andrew Hevesi and Representative Sherry Conley from Oklahoma. First, we will hear from Assemblyman Andrew Hevesi. Assemblyman Hevesi was first elected to serve the residents of the 28th District in the New York State Assembly in 2005. Assemblyman Hevesi is chairman of the Assembly's Social Services Committee. And so I'll kick it over to you, Assemblyman, if you could tell us a bit about the work you've been doing in New York around adverse childhood experiences. Assemblyman Hevesi, that would be great.
There we go. Can you hear me now? I think you can.
Yes, thank you.
Okay. I apologize for trouble with the mute button. So good afternoon, everybody. My name is Andy Hevesi. I'm a assemblyman from New York State. I want to thank Tara and Kate from NCSL for hosting this. It's really, truly a privilege for me to be here. Also, thank you to Dr. Merrick from Prevent Child Abuse America, who I'm starting to become familiar with. I got to tell you that Prevent Child Abuse New York is a fantastic chapter. They've been invaluable to me in learning about this particular topic. And also thank you to NCSL for allowing me to speak for the next 4 hours on this topic. No, I'm just kidding. I know I have 5 minutes. That was in order to give a little bit of a scare into my NCSL friends. But let me tell you why I believe that ACEs is the primary focus, certainly will be for the rest of my career. And let me tell you how I got to that. I have been an elected official for 15 years. And I have been the chairman of the Social Services Committee in the state of New York for several years now. And have worked on issues ranging from domestic violence to homelessness and other issues, the same as many of my colleagues in state legislatures throughout the country. I have never seen an issue like ACEs that has more potential to do more societal good than this particular issue. And the other issues we work on are crucially important. You can spend lifetimes working on increasing access to childcare, or on preventing domestic violence, or on stabilizing homes for people who are homeless. And those are all worthy endeavors, but they don't have the potential societal benefit that a full focus on ACEs has. And that's why I'm going to dedicate what's left of my career to focusing on this particular subject. And let me take you through that analysis if I can. So if you're looking at any particular issue and you look at the potential impacts, the positive good you can do, you start by, in my estimation, looking at the societal problems that you can impact. And if you do it in that way and you reverse and start going through these societal problems, the number of societal problems that ACEs has a causal impact on is remarkable. I'm just going to name some of them. So first, the healthcare crises. When these children who are unfortunately experience ACEs are subject to headaches, fatigue, anxiety, irritability, emotional outbursts, self-harm, over and under eating, alcohol and substance abuse, I'm going to keep going, cardiovascular disease, asthma, obesity, cancer, heart disease, autoimmune disease, they have exponentially higher rates of each of those things. Now, stop right there. If you can prevent those type of health outcomes from occurring, you've done enormous good, not only for the kids and their families and society as a whole, but also for taxpayers, because those types of actions left unaddressed are going to cost huge sums of money. That's only in healthcare. Then if you take a look at some of the other things that are plaguing our society, alcohol and substance abuse, you could look back to a causal link for ACEs, homelessness, generational poverty, education achievement gaps in particular, so kids not achieving in school. If you focus on ACEs and understand the science that when increased levels of cortisol flood into a child's brain based off of the adverse childhood experience that is causing the fight or flight reaction to bolster the levels of cortisol, that exposure, that toxic stress, the exposure to those chemicals has an effect on the structure and functioning of a child's developing brain. And therefore, and particularly for me, I was focused on executive function skills. So now you know you have a structural scientific problem dealing with these kids and now expect them to go learn in school, which is almost an impossibility. The other societal issues that you can have impact on include recidivism and mass incarceration, and most of the issues that we spend our time dealing with in state governments. But if you look at what is the one issue that you can focus on to prevent many of these things happening, helping the kids and their families and society, ACEs is the causal link to all of them. And that's why I believe all of us should be focusing our efforts on this. Now, I want to be clear. I believe my colleagues in New York State and in other states, they do work on ACEs, but they don't know that they're working on ACEs. Some will focus on preventing homelessness. Some will focus on domestic violence. Some will focus on child abuse, home visiting, and the rest. But I don't believe that the understanding of ACEs has hit a critical mass among our colleagues. So I would argue that that would be our first piece of work. And we've undertaken that in New York with the help of some of our friends, particularly Prevent Child Abuse New York. The second, and I believe the most more impactful and much more difficult thing that we need to focus on in the next couple of certainly years, and definitely the increased importance based off of COVID, is the following. Every one of the ACEs, and you know them, I don't need to repeat them, that had been a real problem for causing all of these societal issues has been exponentially increased due to COVID, all of them. I believe child abuse rates are up, even though we're getting less reports in because our children are not in school and having mandated reporters. I believe domestic violence rates are up because of the correct move of our governments to lock people down to keep them safe from COVID. All of these things have spiked. So now, in addition to focusing on prevention of ACEs, we really need to get into the mitigation business. We need to be able to target what has happened to these kids, what kind of trauma-informed services they need, and to provide those services in the context of COVID, where we are having huge financial difficulties. The challenges ahead of us are significant, but I believe that if we don't get a handle on the impacts regarding ACEs and trauma that have just been inflicted on hundreds and thousands and millions of kids throughout the country, and hundreds of thousands certainly in New York State, that we're going to have an exponential increase in societal costs for years to come. We need to get a handle on this problem. So in New York, we've started that effort. I look to work with all of my colleagues here and colleagues in New York and throughout the rest of the country to address these issues. I will tell you that we are considering, some of my colleagues and I, particularly Ms. Conley, I'm honored to share this panel with you and look forward to hearing with you, but also looking forward to talking to you about potentially creating a group of trauma-informed legislators throughout the country so we can share experiences, share policies that have worked, that have not worked, and create a coordinated effort to really attack this problem. Because again, I believe that this is the linchpin, the causal effect of almost all of our societal problems. So I'm honored to be here today, and thank you to NCSL and all my friends for allowing me to participate. Thank you.
Excellent. Thank you very much, Assemblyman Hevesi. We appreciate that presentation, and definitely looking forward to some more discussion with you during the Q&A. Next, we'll hear from Representative Sherry Conley. Representative Conley was first elected in 2018 and currently serves as the Assistant Majority Whip. Representative Conley, could you please share with us what you've been doing in Oklahoma around ACEs?
Thank you so much, Kate. I am so excited to be here today talking to you all, and thank you so much for inviting me. And I just echo everything that Assemblyman Hevesi has said, and I look forward to working with him as well. So my work came, I was an educator before I came into the legislature, and of course, being in the classroom and then being an administrator, I saw the necessity for our teachers to be trained in trauma-informed instruction prior to entering the classroom, and the critical need for resources and wraparound services. So when I came to the legislature in 2019, trauma was one of the first issues that I wanted to address. And so in 2019, my first piece of legislation was House Bill 1905, which adds trauma-informed responsive instruction to the teacher prep programs all across Oklahoma higher ed institutions. During that same year, I partnered with the Potts Family Foundation here in Oklahoma, and I spent the majority of my time ensuring that educators in my district had the opportunity to see the film Resilience, the Biology of Stress and the Science of Hope. I can tell you that I felt like this was the best way to start the conversation with educators who were aware there was a problem. Even educators were aware there was a problem, but they didn't have specifically a name for it. And so ACEs, you know, and that there is hope in ACEs and using PACEs. And if you talk to educators, they will tell you, you look at the protective and compensatory experiences that buffer trauma and stress, that the majority of those can be met in the classroom. Educators and teachers, administrators, working with children, have challenges working with children who have challenges in the classroom because of toxic stress at home. We're relieved that someone was actually addressing the issue, and the teachers are hungry for training and how to help those students. And so, you know, that is a really great place to start if you are looking to start working on ACEs in your state. That same year, Senate Bill 446 was passed. And that required the Oklahoma State Department of Education to provide training for teachers and staff on mental health for students. This year, we are working on legislation, again, at the higher ed level to train pre-certified teachers on a multi-tiered system of support. The MTSS is a framework that is designed to address the core academic and non-academic needs of all students, using an experience-based, data-driven decision-making to identify students at risk for negative academic or even non-academic outcomes. Oklahoma teachers will graduate with the skills and how to use evidence-based data-driven methods, not for the purpose of diagnosing or treatment by the teacher, but it's a framework that requires a look at the whole child to identify and address behavior, academics, and in some cases referrals for mental health challenges. So I believe that the ACEs training and the need for PACEs will be more important than ever this year due to the stress the pandemic has put on all children, not just those at risk, but also on our teachers. And so that's definitely going to be something that we need to address in the coming year. The NTSS legislation was a result of an interim study that I put together to look at the use of suspension rather than dealing with behaviors and the needs of children causing at-risk behavior. So in that interim study, we had a panel of experts from college professors, superintendents, directors of agencies, and we have a group of agencies that I believe are unique to Oklahoma. There's 39 agencies across the state of Oklahoma, which are public-private partnerships. They provide prevention and intervention services in all of our 77 counties. They work with schools and also with individual families. Teachers as parents, first-time offender programs, character training, early pregnancy programs, counseling service, all of these things. The beauty is that since these are funded with both public and private dollars, if the agency assesses a need within the community or school not covered necessarily by those public dollars, the agency can create a program to address that need using those private dollars. The agencies can help provide counseling and other types of wraparound services, saving schools and states money through private donations, and in some cases, bill insurance, Medicaid programs for low-income families, as well as shared partnerships with the schools. So through the interim study, we have put together a working group made up of mental health professionals, school psychologists, State Department of Education, and other agencies to work on that foundation for our future MTSS work. And next year, I believe the plan is to run that legislation to put the MTSS program in all of our schools, giving them a target date to have their framework put in place. We currently have school sites across the state that are building that framework through grants, and we hope to have the MTSS framework in place in all 512 districts within the next 3 to 5 years. I think it's important to note that other states have tried to implement the MTSS, and I'm hearing that they've had some roadblocks, and so I'm looking forward to working with them, trying to determine what those roadblocks were and trying to avoid them, and perhaps that's work that we can talk about in our upcoming committee. I believe that MTSS, to be the reform our schools needs, and in order for it to be successful, it needs to be well thought out, long-term plan for implementation, and I think Oklahoma will see great success in using this, both with our state and our students. I continue to work on creating opportunities in communities to show the resilience film, to bring widespread awareness to ACEs and how they impact education and health outcomes, and spread the good news that there is hope to overcome them.
Excellent. Wow, you sure have been busy in Oklahoma. Thank you so much, Representative Conley, for sharing the several types of legislation that you worked on and sharing about how you partnered with organizations in your state. Public-private partnerships has come up several times on this webinar, and definitely I know is something that many legislators are interested in. I do want to highlight that a couple of the bills you mentioned were included in the audience chat in case anyone is interested in learning more about the specific legislation that Representative Conley shared. So we will move on to our Q&A. We have about 8 minutes or so. There were a few questions that were submitted prior to the webinar that I'll kick us off with. Again, please feel free to add any questions in the chat box as we get started here. You know, it's been brought up, obviously, we're in a pandemic right now. There's a lot of concern at the state level about budgets and thinking about revenue streams. There's just, I think, a lot of thought around cost right now. I'm going to kick the first question over to Dr. Merrick, and then I have a follow-up one for the legislators on the line. But Dr. Merrick, you mentioned potential reductions in negative health outcomes from preventing ACEs. Are there any models that estimate reductions in public spending or other cost savings from prevention?
Yeah, it's a great question that I also saw in the chat. I have to say it's still a gap in this area where we need more of these kinds of cost estimate kind of calculators and really to determine what the return on investment are or is. I will say that there is a widespread belief and a couple of studies that have estimated for every dollar invested in home visiting programs, you see a 7 savings on downstream health costs. That varies a little bit by study in terms of what particular things were measured. But I would just say this is something that I know scientists at the CDC and everywhere are working on, because we really do need those dollars and cents to just add to the literature in this area.
Thank you. Thank you for that. So my follow-up question, and we'll start with Assemblyman Hevesy and then can go to Representative Conley. We know states are facing budget shortfalls, and some have had to delay programs or shift their priorities. How are your states, both New York and Oklahoma, looking at this issue from a budget perspective?
So you're absolutely right. This is an incredibly difficult budget time. So first, let me say that I am hopeful that an agreement will be reached in the next couple of days for the $900 billion to come from the federal government. That will go a long way to assisting backfilling. In New York State, this year alone, we have an $8 billion deficit that's projected to jump up to about $60 billion over the next couple of years, and that's for existing programs. That is before you have to pay for those programs to try to get back to where we were before you start adding. And I will be advocating that we start adding in the form of trauma-informed care and trauma-informed networks to the kids who've been really, really hurt by COVID. And I will be making the case that that's a government responsibility. First, it's a smart move to focus on ACEs at any time. But I'm going to be making the case that it is now a moral and financial responsibility of the government, because the government mandated lockdowns, which I fully support. We had to lock down to protect ourselves from COVID, had an unanticipated consequence, which is the exponential growth in ACEs for our children. That's the consequence. And because that came as a result of government action, I believe it's the government's responsibility to put forward the funds and start mitigating the effects for these kids so they can, like Dr. Merrick said, make sure that their ACEs are not their destiny.
Thank you for that answer. And I'll kick it over to Representative Conley, if you can answer the same question.
So we start back, of course, in February, and we're going to have quite a bit of a shortfall in our budget. My main goal is going to be ensuring that we bring awareness to ACEs and to the trauma that kids are experiencing in their classrooms or outside of their classrooms, having been isolated from their family and their friends and just their whole world being turned upside down. So my goal is to ensure that we don't cut those budgets. Talking about those 39 agencies, my fear is that if the awareness of what those agencies do and how we can utilize those agencies, the funding is already being sent to those agencies. And like I said, with them being public-private donations, they have the opportunity to raise those private dollars, which might be, more of a stress now, not being able to do fundraisers and that sort of thing. But just being able to bring awareness and making sure that we don't cut those things that are already in place that will actually be the resources for our schools and for our communities currently to help our families.
Great, thank you for that answer. The next question is for you as well, that came through the chat box. Can you speak to what policies you think have the greatest impact on students from your perspective working in education?
Thank you. That's a great question. So I feel like ensuring that our teachers are trained in how to relate to children, how to build relationships, and understanding. I think that in years past, if you don't know about ACEs and you aren't thinking about what's going on behind the scenes with the child, teachers sometimes might look at a kid and just think, oh, that's a bad kid, or he's a brat, or whatever you might think about not a well-behaved child in the classroom. But when we educate our teachers on ACEs and, where these behaviors might be coming from, I think that it gives you a better sense of awareness. one of the things that I've seen from teachers is that they have, when they've seen that resilience film, they've watched it and they've said, wow, I had no idea how high my ACEs score would be when we started talking about this. And so they actually are able to, do some self-reflection and deal with some of the things that they realize may be affecting their behavior. And it gives them empathy towards the children and then allows them to start being sympathetic with children that come to school. Being in the classroom, I had a kid that came to school in his pajamas, several days a week because he would get up and he'd come to school late and he wouldn't have had breakfast and, all of these things going on at home. Well, when you know that background story and you know how those background stories impact behavior and education, then you're able to meet that child where they are. And so I really feel like starting with educating our teachers and taking the perspective that you look at someone and say, wow, what's happened to you, not what's wrong with you. And that actually impacts your everyday life too, as well. I mean, grumpy people that you may see at the grocery store or in the line at the drive-thru or whatever, it really changes your focus about how you look at the world. And if teachers will look at their students that way, it really makes a big difference.
Mm-hmm. Yeah. Thank you. Thank you for that answer. We just have about a minute left of Q&A. So I'm just going to ask for very, very brief answers. But I'll kick it over to Dr. Merrick first. So this is 2 questions. What is the best way to bring awareness to decision makers? And if a state legislator wanted to be more involved in this area, how would you recommend that they get started?
Well, the second one first, you have your colleagues here on this call that I'm sure would encourage you to reach out to them. You have NCSL, you have PCA America, you have resources. We can get you the tools, sample legislation, the best evidence, the articles if you want the primary evidence. So that's an easy one. And I will say that I will repeat something that Representative Conley just said, because I think it is one of the silver linings of this pandemic, is that maybe many of us have developed more empathy for one another. We are all stressed out with kids in our home, and those of us who are super fortunate to have jobs and to have internet access and to have food and shelter and health insurance and all the things, and we're still stressed out every moment. So we, hopefully can normalize that in this time of physical distancing, we need social and emotional connectedness more than ever. Those are powerful protective factors year round, and we can have them at each level of the social ecology, in our families, in our communities, and in our policies. Policies set the context for health and well-being. So I think when we're able to communicate that urgency, but also that, again, shared experience with policymakers, they really get it. They really get it.
Thank you for that answer. And I'll kick it over to Assemblyman Hevesy. If you could, 20 seconds or less, answer that question.
20 seconds. NCSL is great. PCA America is great. Look, we need to work together, and Representative Conley is 100% right. I believe the training and a public understanding of what ACEs are and their real impacts is where we need to go next. We really need to focus on that, and then focus again on providing trauma-informed care. I hope that was within my 20 seconds. Thank you for having me here.
No, that's great. Thank you. And Representative Conley, you'll have the last word. Anything you'd like to add?
Well, in getting involved in this, joining the CTIPP and becoming part of the committee and working with Assemblyman Hevesy and I would be a really great start. And I look forward to working with everyone across the nation on this very important issue. Thank you for having me here today.
Excellent. Well, thank you all so much for your time today. It was an absolute pleasure to moderate this discussion with you all. You really are champions in your states and nationally. Thank you all for joining us for the webinar today. I just want to remind everyone this is one of 9 webinars in NCSL's Public Health Webinar Series. We have several more webinars lined up, including one tomorrow on reducing maternal mortality and morbidity. For a complete schedule and registration details, you can follow the link on the slide or in the resources document. And I'd like to wrap up with one final thank you for our presenters. We really greatly appreciate your expertise that each of you were able to provide today. I would like to again thank CDC for their support of this webinar. And following the webinar, there will be a very brief survey, and we ask that you all do fill it out. It really does help us identify ways to support your work on this issue. Thank you all again for participating today, and have a wonderful rest of your day.